Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi, everybody. Tom Viola with Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, next up in our review of the antibacterial agents that either have been used in dentistry or have an effect on dentistry would be the fluoroquinolones. You may not recognize that name, but you may recognize the names of the drugs in this class of antibacterial agents. They'd be drugs like ciprofloxacin, Cipro, and levofloxacin, or Levaquin. So what made these drugs so special anyway? Well, when they came on the scene, they were revered for their ability to kill those nasty bacteria. They are bactericidal. They destroy the bacterial DNA. Much like metronidazole, you destroy the bacterium's DNA, no more bacterium. Well, that's amazing, and they were highly revered for their fantastic kill rates. If you had that kind of infection, the upper or lower respiratory infection that really had you on your back, like pneumonia, well, these were the drugs you wanted. If you had a urinary tract infection or genital urinary infection that had you down as well, this was the drug you wanted. If you had sinusitis that, was unrelenting, this was the drug you wanted. So these drugs were, again, highly revered because they could kill those nasty bacteria and save people from these rather deep-seated infections. But as we started to use the fluoroquinolones, we started to realize that they had some nasty side effects, like tendinitis. There were case reports of people who developed Achilles tendon ruptures spontaneously after using Levaquin, not just during the therapy, but for weeks later, as well as things like restless insomnia, skin rashes, altered blood glucose, psychoses. Wow! And of course, they were earning themselves black box warnings from the FDA, which meant the risk of using the drug started to outweigh the benefit. Okay, well, that's great, Tom, but what does that have to do with dentistry? Well, these drugs also altered the QT interval. So it's that part of the EKG, the QRST complex. The time it takes for that to take place is called the QT interval. And in some cases, it's as individual to a patient as a fingerprint. If you alter the QT interval, you increase the risk of arrhythmia. And let's face it, we use pro-arrhythmic drugs in dentistry all the time. They're called local anesthetic agents. So that's how the quinolones are all often used as great kill agents when necessary, but can have an impact on dental practice. That's the latest edition of Fast Facts Pharmacology. Looking forward to seeing you next time. Until then, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoromax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.